these are the only two ones that you look for the biopsy in. In vasculitic lien, it is recommended that if you want to do a biopsy, hematoxin eosin staining one, a lien should be at least 72 days old, right? So more than 24 hours and up to 1 week, histopathology of a vasculitic lien can be done, preferably 72-hour old. But if you want to go for immune fluorescence, a lien should be 1 day old, 24 hours old, except in IgA vasculitis, where IgA persists for up to 1 week. So that's a difference over there. Immune fluorescence, if you're doing direct immune fluorescence, we have different medias. Even normal saline is preferred. So a normal saline, or if you have a special media like Michelle media, if some lab is providing, fair enough. Otherwise, go for simple normal saline. But formalin is for the histopathology ones. Now coming, and the other point in vasculitic lien is that if we are suspecting ANCA-associated or rheumatoid-associated vasculitic lien, we need a deeper lien, because deep or post-capillary venules are needed in order to observe the vasculitic changes. In order to see endothelial damage and thrombi and perivascular infiltrate, that is manifested at least in a 24-hour lien. Prior to that, it will be too early. Only you'll be able to see fibrin leak, maybe neutrophilic infiltrate, nothing more than that. Coming to the connective tissue disease biopsy. A lien, a well-established lien, at least 6 months, is good enough to go for histopathology and even immune fluorescence. But the catch is that the lien should be having signs of active disease. If it's a burnt out one, especially if you're considering the cutaneous LE, then yield will be low. We need a lien with a high yield. If we want to see histopathological changes of cutaneous LE with different parameters from the stratum corneum to the fat, where you may be expecting paniculitis or fat changes, inflammatory signs over there, you need biopsy accordingly. Immune fluorescence in cutaneous disease is done from the same lien. That is a difference from the immune bullous disorders like pemphigus and pemphigoid, where we take a lien within 1 centimeter of a blister. But in connective tissue lupus immune fluorescence, the immune complexes are present within the lien, and we want to take immune fluorescence from the same. So either you can take maybe a relatively large punch and do a vertical dissection of the same punch, or you can take double punches for that. Hope that answers you.
Thank you so much, Mom. Thank you so much for a really enlightening and good discussion. Now we come to the conclusion of this session. I will request we'll start the shield distribution for the panelists, for which I request Professor Abid Farooqi to please come and give the shields, and Professor Wajahat Aziz and Dr. Javed Malik and Professor Sumaya Farhan to give the shields to the panelists.